Hello, everyone. Good afternoon. My name's Magella Kilkey from the University of Sheffield, and I'll be chairing today's seminar. So the seminar is part of the Centre for Care seminar series. In our seminar series, we invite colleagues, partners, and experts whose work aligns with the mission of our centre to share their work with us and with our audiences. So I can see we have people from the University of Sheffield, the Centre for Care's partner universities, but more widely than that as well. The aim is to deepen our understanding of the critical issues in social care in the UK and around the world. So we're delighted today to welcome Isabel Schutz. Isabel is an associate professor in the Department of Social Policy at the London School of Economics and Political Science. Her research focuses on the intersections of migration and social policy. She's published widely on migration and care work, citizenship, migration and inequalities, transnational social protection and social rights. Her recent research includes a Leverhulme Research Fellowship on the integration of care workers in labour migration systems. And it's that research that Isabel is going to draw on in today's presentation, which focuses on the international recruitment of care workers and in particular, the ethical challenges of such recruitment. So Isabel will talk for about 40 minutes and then we'll have time for Q&A. If something kind of comes to your mind, a question or a key point during the presentation and you're afraid you'll forget it, just pop it in the chat and we'll pick it up when Isabel finishes. So welcome, Isabel. Over to you.
Thanks very much, Magella, and thank you to you and other colleagues at the Centre for Care for having me present on this work. As you say, what I'm presenting today draws from some research that I carried out last year through a Leverhulme Research Fellowship. And what I'll be focusing on is very much about recruitment within care labour markets, and specifically international recruitments, and thinking about some of the issues around ethical recruitment as it's referred to in policy and practice. So before starting, I just wanted to contextualise the research in relation to a body of literature that has grown significantly over the past couple of decades, really, which has drawn attention to the role of migrant labour in care systems in the UK and, of course, in many other countries in the context of ageing populations, increasing demands for care, and the challenges around recruitment and retention in a sector which has been predominantly low-waged and work that has been predominantly carried out by women, both in terms of thinking of paid and unpaid care labour. So who are migrant workers within those systems? So the literature has identified migrant care workers as playing a significant role, but the term migrant often masks as much as it reveals, in that, of course, migrants are not an homogenous group of people, they're heterogeneous, and indeed migrant workers in social care are heterogeneous. And in the past, with respect to care workers in the UK context, but indeed in other country contexts, this has more often than not involved the recruitment of people post-migration to the UK. So that is people who've migrated to the UK through a variety of different migration trajectories, including people migrating as family members of people already settled in the UK, or accompanying other people on family visas. It includes students, it includes people who've come and claimed asylum in the UK. And of course, it also includes people who've lived for many years in the UK and may have rights of permanent residence and indeed may have naturalised as UK citizens. The literature on other European country contexts has tended to focus on cross-border EU mobility, so the ways in which the expansion of the European Union facilitated cross-border mobility between various countries such as Germany and neighbouring EU member states. But typically, the recruitment of care workers via mainstream labour migration programmes, or in some cases through labour programmes that specifically target care workers, has played a more limited role, and certainly in the UK context, that is partially indicative of the gendered social and economic status of care labour as low-skilled and low-waged work. So in the context of labour migration programmes that have tended to exclusively target so-called skilled workers, care workers have tended to be excluded through those systems. So I'll be focusing specifically on the ways in which over recent years the UK has opened up its skilled worker visas to care workers, and in doing so opened up international recruitments in the care sector, and specifically go on to think about recruiters' experiences and role within that context. So just to say a bit about international recruitment and labour migration more generally. So international recruitment is a key feature of global labour markets and labour migration processes more generally. So it's been the focus of attention in much of the wider migration studies literature. And that literature has pointed to the ways in which the governance of international labour recruitment has moved away from a primarily state-organised system in which governments played a central role, both in terms of recruitment through bilateral labour programmes, as well as overseeing the conditions of recruitment and employment, to a more market-oriented system in which private recruitment agencies play a key role. So within those markets of international labour recruitment, there are a range of different actors, including not just recruitment agencies, in connecting workers in countries of origin to employers in countries of destination, but a variety of other agencies through those so-called supply chains, and indeed a variety of formal as well as informal networks that operate across different institutional and legislative contexts. So regulation has been seen as difficult in the context of global labour markets, partly due to a lack of transparency of supply chains, as well as the difficulties of enforcement of regulation across different jurisdictions. But at the same time, it's also important to recognise that there may as well be tensions between regulation and access to economic opportunities for migrants. That is, that regulation does not necessarily operate in the best interests of migrant workers. So within that broader context, there has been, in terms of debates around the management of labour migration, there's been increasing attention both at the international level as well as in national policy contexts to ethical recruitment as a potential win-win in terms of allowing for managed labour migration that is fair and safeguards the conditions of labour for migrant workers, ensuring the safeguarding of migrant workers rights. So that's evident in, for example, the Global Compact for Migration, which includes the objective to facilitate fair and ethical recruitment. That objective including emphasis on the improvement of regulations of recruitment agencies, including prohibiting recruiters and employers from charging or shifting recruitment fees or related costs onto migrant workers. And I'll come back to that issue specifically. So now turning to international recruitment in the social care sector, and specifically the care sector in the UK context. So international recruitment has for long been a key part of the UK's healthcare system. So it's been key to the recruitment of health care workers, and indeed it continues to be a key part of the NHS workforce strategy. So as I mentioned previously, care workers have typically been excluded, although not entirely excluded, from worker visas over recent years due to salary and skills thresholds. But in the context of the pandemic and indeed increasing challenges around recruitment and retention, the health and care worker visa, which is part of the skilled worker visas that the UK administers, opened up to senior care workers in 2020 and to care workers in 2022. And following on from opening up those visas to care workers, we saw a rapid expansion of international recruitment of care workers. So those care workers are recruited and employed by social care organisations who have to first obtain a sponsorship licence from the Home Office. And in acting as a sponsor for those care workers' visa is tied to their sponsor. And I will come back to those dynamics of the sponsorship system as well, thinking about ethical recruitment. So we saw a rapid expansion of international recruitment of care workers. The top countries of nationality since 2021, including India, Zimbabwe, Nigeria, Ghana, Bangladesh, and Pakistan. And indeed, while pre-Brexit, EU migration did form part of the care workforce in terms of groups of so-called migrant workers entering the care sector. International recruitment is almost exclusively non-EU. So just to put that into context with labour migration to the UK more broadly. So the data here is from the analysis carried out by the Migration Observatory, so you can easily access Home Office data that the Migration Observatory has compiled, looking at worker visas more generally and care worker visas specifically. So we can see that amongst the different occupational groups applying for skilled worker visas over the recent period and up to the year ending March 2024, care workers and home carers have constituted the main group of skilled workers, that is the main group of applicants for those types of visas. But interestingly, and going back to the point made about the ways in which those workers were previously excluded from worker visas, care workers are predominantly still classed as lower skilled in terms of the skill levels of care workers applying for those visas. So since the opening up of that visa and what that's meant for the care sector in terms of the recruitment of workers on those types of visas, there's been growing research, both academic research and research carried out by a range of organisations looking at what's been going on, essentially. So research by Kalpa Karicha and colleagues at King's looked at the different recruitment channels through which social care employers were recruiting workers internationally, and that included through online advertising, employee networks, immigration lawyers, as well as use of international recruitment agencies. At the same time, there's been growing concerns about the exploitation of care workers recruited through this visa, and concerns indeed about the misuse of the visa, including the essentially applications for sponsorship and visas that have brought people over to the UK, where they've ended up without a care job to go to. So I'm not going to go into detail about those research findings, but just to contextualise that before picking up on some of these issues with respect to my own research. So at the same time, the recent workforce strategy for adult social care in England has emphasised that while more needs to be done to address issues of recruitment and retention with respect to the domestic workforce, international workers remain crucial for the sector. And indeed, the Home Office, in terms of immigration policy developments, should be mindful of the sector's need to recruit internationally. And there have been efforts across relevant government departments in terms of thinking about the extent to which ethical recruitment practices are applied, or indeed what measures need to be introduced to ensure ethical recruitments in practice. Okay, so ethical recruitment in terms of health and social care is situated in terms of the broader emphasis in terms of the governance of international governance of healthcare with respect to addressing the inequities of richer countries recruiting health workers from poorer countries. So the focus has tended to be on the extent to which there are ethical issues to be considered where higher income countries are essentially recruiting workers from countries that face the greatest challenges in terms of health and the greatest challenges in terms of health worker shortages. At the same time, it's been discussed in terms of the extent to which those processes ensure the protection of the rights of migrant workers who are internationally recruited. So the World Health Organization's Global Code of Practice on the international recruitment of health personnel gives emphasis to ethical recruitment in terms of global inequalities with respect to limiting active recruitment from a list of safeguarded countries, what's referred to as the red list, to the extent that those countries who are actively recruiting from countries that typically have faced greater challenges in terms of their health systems should not be doing so actively from that specific list, that red list of countries. So the Code of Practice on International Recruitment of Health and Social Care Personnel in England connects with that WHO Code of Practice, and specifically aims to promote high standards of practice in the ethical international recruitment and employment of health and social care personnel. And it sets out a range of guiding principles which includes no active recruitments from countries on the red list, but also a range of other principles, including no charging of fees to candidates, and ensuring that care workers recruited internationally have the same legal rights and protections as UK trained staff. So social care employers, when recruiting through a recruitment organisation or collaboration, are expected to only use organisations that comply with this code of practice. And in facilitating that process, NHS Employers maintains a list of recruitment agencies that have been registered on its ethical recruiters list. So recruitment agencies wanting to operate in the international recruitment of care workers are, and indeed more generally in terms of the recruitment of health workers, are required to register on that list. And then the idea is that employers can use that list. It's not recommending agencies, but employers can use that list to identify recruitment agencies through which they can access recruitment services in recruiting internationally. So to the extent that international care worker recruitment is regulated, that list has played one particular role in terms of the extent to which that's supposed to support the implementation of the code of practice. But beyond that, there's relatively limited regulation of international recruitment. So social care employers, of course, must be CQC registered, and they're required to obtain a sponsor license and be compliant with immigration rules overseen by the Home Office. But recruiters themselves are not licensed, unlike recruiters of other migrant workers in sectors such as agriculture, who are licensed by the Gang Masters and Labour Abuse Authority. So the Employment Agency Standards Inspectorate can inspect and investigate employment agencies and recruitment agencies for breaches of employment agency law. And indeed, NHS employers can refer agencies to the Employment Agency Standards Inspectorate. But as I've said previously, recruitment agencies are not licensed through that particular agency. So what I'm going to touch on in terms of the findings of my research reflects very much and focuses very much on the experiences of ethical recruitment in practice by recruitment agencies working in this sector. But it's important to emphasise that this is a shifting landscape, and indeed, since carrying out the research, there have been a number of developments, including if you like, soft approaches to regulation, including the development of toolkits, including the toolkit developed by DHSC and Skills for Care, aimed at providing better information and guidance on ethical recruitment to employers. So what I'm going to focus on looks at specifically how recruiters understand, navigate, enforce, or resist the unethical or ethical recruitment of care workers in practice. And I'm drawing upon interviews that were carried out with recruiters, as well as a more limited number of interviews carried out with other significant actors, including care workers themselves, employers and legal and support services for international care workers. And those interviews were carried out between the end of 2023 through to mid-2024, which is approximately 2 years since care workers were made eligible for a health and care worker visa. And these recruiters were predominantly accessed via the ethical recruiters list. But the ethical recruiters list is itself a shifting landscape. So that list has evolved over time, and that includes the removal of some recruiters, not necessarily because they're bad recruiters, but they may not wish to continue being on that list. They have to re-register every year if they wish to continue being on the list. But it does include also changes where some have been removed following investigations. So the recruiters interviewed varied both in terms of the size of the organisation, how long they'd been established, the countries from where they recruited, and the types of services that were provided to both to workers and to employers. So I've included here a table which encapsulates some of that diversity in terms of the types of organisations, which included some that were recruiting both care workers and health workers, some that were recruiting specifically care workers, some that recruited care workers alongside workers for other labour market sectors. But with respect to the recruitment of care workers, this was mainly care workers working residential care services. So some did operate as recruiters for home care, but this was much more limited. And wider research has also pointed to the difficulties of international recruitment within the home care sector specifically. So those recruiters provided a wide range of services, which included selecting candidates in countries of origin, assisting with immigration processes, providing induction services, as well as relocation services for care workers. Some assisted care workers on arrival in the UK, and some provided information to employers on international recruitment and indeed some on immigration compliance specifically. So in short, there is a huge range of different types of organisations, even amongst those that are on this ethical recruiters list, and they provide a variety of different services. And some of these organisations are very small, including those that involve one individual, through to larger established recruitment agencies operating across different labour market sectors. So where were these recruiters recruiting from? So as the wider data shows in terms of grants of visas to applicants for care worker visas, Brexit shifted recruitment for those already established prior to Brexit exclusively outside the EU. So for direct recruitment, that is recruiters who were selecting candidates in specific countries of origin, those countries of origin often connected to the informal networks and indeed the countries of origin of recruiters themselves. So recruiters may themselves be from the countries of origin of workers who they recruit, and they may at the same time have informal networks within those countries, including networks with different training providers, as well as other local agents that facilitate those recruitment processes. Some recruiters had developed relationships with local agents in the specific countries that they recruited from. And indeed, as I'll come back to, the development of those sorts of relationships was seen as critical in terms of ensuring good practice in terms of recruitment processes across countries. So ethical recruitment was very much understood by recruiters in terms of not recruiting from the red list of countries. So it was very much framed in terms of where you recruited care workers from. And indeed, there was relatively good understanding of which countries were seen as being on the red list. But sometimes there was a lack of clarity with respect to changes to the red list and which countries had previously been permissible and how shifts in terms of the countries that had been permissible had been put on the red list and to what extent they could continue to recruit. And indeed, those changes across this list of safeguarded countries sometimes required changes of direction or indeed stopped recruitment processes where recruiters were not able to be directly recruiting from that country, but nevertheless, that didn't stop workers themselves from red list countries being able to respond to advertisements for care jobs directly, that is, not via recruitment agencies. So in terms of unethical practices within the sector, a key issue that was flagged by recruiters concerned the charging of fees to workers. So charging fees to workers was identified as something that was not limited simply to actors outside the UK. That is, it was not externalised as a problem that was specific to the countries of origin of care workers. So whilst to some extent recruiters would place emphasis on the ways in which it might be difficult to enforce ethical recruitment practices when we're operating with additional agents who were subcontracted through the supply chain, they emphasised that the charging of fees was something that was very much embedded within the care and immigration and employment system within the UK itself. So that included the extent to which they perceived social care employers, immigration lawyers, and indeed recruiters as being equally culpable for the charging of fees. I've given you some quotes here from some of the interviews, including one recruiter that emphasised that they knew so many care companies that use Indian agencies and don't realise that those workers are paying off their life savings to these agencies, and the agencies aren't disclosing it. So at times this was seen as employers inadvertently recruiting via agencies that didn't charge them a fee without knowing that actually those fees were being diverted to care workers themselves. But others placed emphasis on the fact that actually providers were well aware and indeed sometimes implicated in those processes of charging fees. So another recruiter noted that a number of providers have said, I know there are plenty who are taking £20,000, £30,000 off people, and that they had a provider who sacked workers they provided to them because they realised they could charge £20,000 to people. So these dynamics of shifting costs onto care workers and indeed making profits out of care workers had risks for recruiters themselves. So it had risks for recruiters that didn't want to be tarnished as unethical in terms of their practices. So some chose not to recruit specifically in the sort of care worker sector and chose to focus specifically on healthcare workers because they thought the recruitment of care, the sector of recruitment of care workers was embedded too much in these sorts of unethical practices and charging fees. But also some emphasised the difficulties of actually competing with other organisations that don't charge providers. So they talked about the extent to which it was difficult for them to recruit it was difficult for them to maintain business with providers who essentially could get workers at lower costs, reduced costs, or at no costs through agencies who were charging fees to workers rather than employers. So, interestingly, recruiters actually placed a lot of emphasis on the need for stronger regulation. So, the ethical recruit, in terms of thinking about the extent to which recruiters are regulated, the ethical recruiters list was seen as pretty limited as a means of regulating the recruitment of care workers internationally. It was seen as limited to the extent that it simply required the self-certification of recruiters who were required to complete an online questionnaire saying that they adhered to the that they understood and adhered to the code of practice. As one recruiter emphasised, to get on the list, you essentially self-certify that you'll behave yourself and nothing more than that. Another referred to applying for the ethical recruitment list, answering 10, 20 questions, which were then approved. And the extent to which beyond that, there was pretty limited checks of what was going on, to the extent that they felt that nobody followed up to see whether they were actually in practice adhering to the code and the standards within the code for ethical recruitment. So, sorry, just go back. So many of the recruiters place emphasis on the need for what they refer to as a proper register of people. That is the licensing of recruiters bringing in migrant labour to the care sector. And that without a proper system for licensing, it was very difficult to essentially enforce ethical recruitment in practice. And the system, in essence, was simply relying upon the responsibility of recruiters themselves to adhere to the code of practice. So recruiters nevertheless place emphasis on their own efforts to self-regulate. So they referred to the ways in which they had they sought to develop strong relationships with agents with whom they worked in countries of origin of candidates, and the need to meet with and ensure understanding of standards that they expected third parties to adhere to. So some had drawn up contractual agreements both with those local agents as well as with candidates, requiring them to sign a document saying explicitly that they had not charged or been charged fees in the recruitment process. And that was important to the recruiter themselves in terms of ensuring that they were not, as they put it, tarnished with unethical practices. It also included organisations developing their own codes of conduct, setting out what they expected all parties, including employers in the UK, as well as subcontracted agents outside the UK and candidates to adhere to. And charters that set out the standards of recruitment to candidates, so making explicit to candidates that they should not be charged fees, either by the recruitment agency itself or through any third party. So with respect to providing information and support to care workers, recruiters actually played, or some recruiters played a role in the recruitment process that went beyond just simply connecting candidates in countries of origin to employers within the UK. So some played a role in providing information and critically information about the nature of the job to care workers or candidates rather in countries of origin. And that information was seen as critical in terms of making sure that candidates knew were sufficiently informed about the nature of the work and the job that they were applying to and that they were taking up, as well as providing accommodation and support on arrival. As one recruiter here notes, part of what they do is not simply about getting someone into a job, but making sure that they're housed in good accommodation, that the conditions under which they are employed are suitable. And it also, for some, involved playing, to some extent, a mediating role with employers in terms of the rights of the workers who they had placed. So whether formally or informally, some recruiters acted as a kind of negotiating point between workers and employers on issues such as hours of work, where workers were unhappy because of the conditions under which they were working. That was seen as, by some, as I say, as a sort of critical role in terms of ensuring that beyond the recruitment process, employment practices met the needs and expectations of workers. So I've talked about recruiters' experiences. I'm just going to finish up by touching on some of these issues in connection with employers and care workers' experiences as well. So employers, to the extent that they are regulated in international recruitment, of course, are very much accountable to the Home Office in terms of their sponsorship licence. And indeed, among the employers that we interviewed, many were concerned about a perceived clampdown on sponsors of care workers by the Home Office in light of concerns about exploitation of workers within the sector, and were concerned about the suspension and revocation of sponsor licenses, not simply for necessarily abuses and exploitation, instances of exploitation of care workers, but sometimes for often what they perceive to be relatively minor breaches, such as poor record keeping. So employers were, in that context, sometimes unwilling to take on care workers who had come to the UK but had tried to leave an employer, potentially because that employer did not offer them the conditions of work they had expected. But employers were worried about taking on so-called displaced workers for fears of unethical practices having implications for their own sponsor licence. So one employer who I've quoted here talked about their concerns of recruiting workers who somehow may have been charged fees or whatever prior to coming to the UK, or indeed within their previous job within the UK, and how this may have implications for potentially that employer having their sponsorship licence revoked. And finally, at the same time, within these processes and questions around the regulation of ethical recruitment, both recruiters and other organisations interviewed, including those providing services supporting international care workers, emphasised that actually the system of sponsoring care workers, that is via the health and care worker visa, actually in some ways made it harder for care workers to actually exercise agency themselves in terms of their ability to either leave an employer or indeed to report unethical practice. Why? Because if they lost their job, or indeed an employer lost their sponsor licence, the care worker is actually penalised insofar as they then also lose their visa and are required within 60 days to find work with another employer. And of course, at the same time, loss of a visa, but also loss of a job, has financial penalties for workers. So where workers are indebted due to fees and other costs of migration to the UK, of course, it may not necessarily be in the interests of workers to report instances of unethical practice. Okay, so I've gone through quite a range of different issues, but just to bring together some concluding points, whilst a lot of the wider literature on labour migration and the regulation of ethical recruitment has emphasised the difficulties where regulation has to cut across jurisdictions between countries of destination and origin countries. The findings really emphasise that these governance and regulation processes are not simply external to the care sector or indeed the employment sector within the UK, but need to be seen as very much embedded within those systems. And while shifting costs or profits onto care workers by charging migrant workers fees may be resisted by good recruiters through their business model, some recruiters may also serve to enforce ethical recruitment between employers, workers, and other agents, but without strengthening the regulation and enforcement of ethical recruitment standards. Good recruiters, so those that do adhere to the code of practice, are at the end of the day competing with unethical practices in international care labour markets. And of course, at the same time, in thinking about strengthening regulation, ethical recruitment, of course, critically depends on labour migration programmes, including the health and care worker visa, making care workers able in practice to actually claim their rights and protections as workers. Okay, thank you.
Thank you so much, Isabel, for a really fascinating presentation and such I think quite an unusual focus on recruiters. So really bringing something new to our knowledge of what's happening. I'm sure there are lots of questions on part of the audience.